Good afternoon. My name is Catherine Stocky. I'm a nurse at Hartford Healthcare in Hartford, Connecticut, and I'm here to address Governor Lamont and the state legislators of Connecticut about the public health option for expansion of healthcare coverage in Connecticut. I come to speak to you today as a healthcare worker, a woman, a mom, and a resident of Connecticut. I'm proposing to take the side of the Democrats, that they put a bill on the table to expand the healthcare coverage to more Connecticut residents. This expansion bill would allow residents the ability to have access to more healthcare services like dental care, non-emergency transportation, and coverage to more of their family members. Governor Lamont vetoed the bill by the Democrats and did not gain support for his own bill to pass either. The differences between the two bills was that Governor Lamont wanted to not include a public option plan for children that would cover them for hospital care, emergency visits, and regular preventative care visits as well to their primary care physicians. Neither bill got passed, and so we continue on with the COVID relief bill to protect those who have lost their jobs during the COVID pandemic. The pressure from insurance companies to Governor Lamont is showing that big-time power companies are continuing to make their home here in Connecticut, are reminding politicians and the residents of the state that big companies are continue to win and continue to put money in their pockets instead of providing coverage for healthcare coverage and other necessities to the residents of Connecticut that need it. I'm not disagreeing that it's important to support jobs and growth within the state, but when you're making huge profits for themselves and subsidies for the state, then the rest of the little guys have to wait their turn. Disparities and prejudice in healthcare have also been seen during this pandemic, and the number of uninsured participants in America are rising. Affordability of healthcare for the common working person is decreasing, and racism has brought up to a new level in this country because healthcare is not being provided to all. Connecticut decided that the expansion of the healthcare bill should be denied, and legislators continue to pursue some of the coverage for their own residents through the federal funding, and is now being called Covered Connecticut, which basically is continuing to support a public option bill. So I ask the legislators of Connecticut that represent this great state, if you can agree to do this with federal relief money, why can't we come to an agreement to keep this plan alive? It is clearly written how much these factors of healthcare access and affordability play in all of the lives for the best healthcare possible for the residents of Connecticut. Our state needs to follow the lead of other states in America that have already adopted a public option plan with universal healthcare options and have worked with insurance companies and pharmaceutical companies to make sure that there are options to continue care for all people. Thank you very much.